A very warm welcome to all our viewers and welcome to a new edition of the Daily Debate. Tonight you're in company of myself and Meher, and of course in today's episode we have a lot in store for you, but our main focus of course will be shedding more light on the activities of the largest African medical exhibition and conference entitled the Africa Health ExCon in its third edition. Of course, it launched under the order of President Abdel Fattah al-Sisi under the theme Your Gateway to Innovation and Trade. It's going to be held from the 3rd till the 6th of June 2024 at El Manara International Conference Center here in Cairo. One other and all players in the health field in the African continent. So that and much more later on with our guests that will be joining us in the studio later on tonight's edition of the Daily Debate. But before we get into that, with some of the news, the headline with the Foreign Minister Samah Shukr, the Cypriot Foreign Minister Konstantinos Kombos, who agreed on Tuesday on the need to reach a ceasefire in Gaza. Speaking at a joint press conference following their talks in Cairo, Shukri said they also agreed on rejecting the forced displacement of Palestinians. In his remarks, the top stressed the strategic ties between two countries in various fields. He said both sides are coordinating over regional and international issues of mutual concern. For his part, the Cypriot minister said they'd signed a memorandum of understanding regarding the Egyptian labor in Cyprus. Minister added the two sides also discussed cooperation in the field of energy. Their talks tackled means of reaching a ceasefire and containing humanitarian crisis in the Gaza Strip. Two ministers also discussed extensive deliberations within the framework of the strategic relationship binding the two countries. Still with our news, the foreign ministers of Egypt, Qatar, Jordan, Saudi Arabia and the United Arab Emirates stressed the significance of dealing seriously and positively with the U.S. President Joe Biden's suggestion to reach a deal that would guarantee a permanent ceasefire. This came in a joint statement issued by the ministers of health to discuss mediation efforts to strike a hostage swap deal. The deal being deliberated includes a permanent ceasefire, as well as release of hostages, as well as allowing sufficient aid deliveries to the Gaza Strip. Welcome back. And as earlier today, we have more on the Africa Health ExCon conference, which is being held, of course, a very important medical exhibition that is being held here in Egypt from the 3rd till the 6th of June, bringing together experts from all over the continent. We have more details in this report, and we'll be right back, joined in the studio by our guest for this evening. Do stay tuned.
Under the patronage of President Abdel Fattah al-Sisi, activities of the third session of the largest African medical exhibition and conference, Africa Health ExCon, was launched under the theme Your Gateway to Innovation and Trade during the period the 6th of June 2024 at Al Manara International Conference Center in Cairo. This is the largest showcases expertise and contributions to strengthening the medical sector in the African continent. The Health ExCon 2024 conference, organized by the Egyptian Authority for Unified Medical Management, is a golden is working in healthcare services in Africa, which contributes to accelerate growth of these industries all over. The bring to representatives of the provide them professional opportunity to learn about the latest products and services in various medical sectors. The conference attracts more than 500 companies from various countries worldwide. The various Egyptian stages are keen to support and organize the conference, believing in its importance in strengthening Egypt's position The Regional Center for Medicare after Egypt has succeeded in launching the business platform to experiences at the level of African continent and international contributions in the medical sector. The most important objectives of the Africa Health ExCon 2024 conference and exhibition are commitment to the African Union agenda for the year 2063, especially in its aspirations towards a prosperous Africa, which is based on achieving comprehensive growth and achieving localization of medical industries, especially pharmaceuticals, and confronting the challenges that face the continent of Africa. The conference and exhibition also aim to enhance trade exchange between various countries of the continent, which is another essential part of African Union's agenda that contributes to strengthening the medical economy and promoting sustainable development in the long term. The Africa Health Conference is an important strategic platform for developing the health sector in Africa and enhancing cooperation between various stakeholders to achieve goals of sustainable development, which confirms Egypt's pioneering role in the field of medical care and its capabilities in providing high-quality medical services to patients from all over the world.
Operate this for its third edition and being held under the orders of the
Good question to start our
Yes.
conversation.
Sure.
So if we are talking in its third edition, we are discussing two things: what happened from the second edition till the third edition,
Yes.
and what's new for this year. So the first day and the opening was focusing on the achievements that was actually the recommendations coming from the second edition.
Okay.
And the first on top of the recommendation was how to localize manufacturing inside the African continent. And just to put the things into perspective and putting figures, as an African continent, we only produce 5% of our need in medical supplies and pharmaceuticals. How making the one country in terms of production of our own land manufacturing of pharmaceuticals. 10% is between what are actually from raw materials, biologics, and advanced technologies.
Okay.
So this gap is a very good transfer. Technology transfer was the top priority. How we can actually transfer technologies for vaccines, for example, so we can manufacture our own mRNA vaccines. Remember during
struggle.
Yes, we struggled a lot. And one which was actually very significant during the if we do have our own local manufacturing, we own the power of our own fate. That goes funding them. We need the technology and prepare strategy that our own things, whether vaccines or medications. For vaccine, the third, we managed current platform mRNA vaccine manufacture in vaccination and make fun and transfer residential as well. The third, and what's currently as well a focus for current in the opening by Professor Dr. Dr. Anan, His Excellence, the President of Unified Purchase Authority, is how can actually Africa be able to be the pharmacy of the world, because we do have all the resources necessary actually claiming this first role. So what happened from the second to the third, and as I was saying, on the top of our agenda for this year as well is validation again. Second thing is citizen centricity. Predict in the future rather than just treating what's coming
dealing with the
and dealing with the consequences.
Absolutely.
Yes.
Right. So since you mentioned these two main points, manufacturing of medicine, etc., and the initiatives carrying them over to Africa. To summarize quickly,
yes.
Let's focus on the first one. How far has Egypt come? I mean, Egypt really is becoming known as a health hub, not just with pharmaceutical manufacturing of medicine, etc., but even for treatment facilities, etc. How far has Egypt come with regards to the first aim? How far have they come from the second edition till the third edition in this regard? And what lessons have they learned? As you said, for example, during the COVID pandemic, African continent struggled. We got them pretty late, the whole scenario. Yes. So tell me, is Egypt with regards to vaccination production, medicine production, accessibility of these medicines?
So nice targets were actually put from the second edition. For example, one of the biggest burden is actually dialysis in nephrology. And for kidney dialysis, the kidney is actually to for dialysis in Egypt. And then many 100% is actually incorporating a lot of this, producing already with grapes in Spain, and we're getting the plasma derivatives. Egypt, we received the fourth shipment. Currently, the plan is in a couple of years to produce it completely inside Egypt. Another thing is the biologics. The biologics are actually treatments which is very complex and advanced and a very, very expensive terms. For example, if we were treating a breast cancer case with like 1,000 Egyptian pounds in the past, the biologic treatment which is currently available in the world, we're talking about a million, couple of million per patient of a treatment cost. So this huge gap is because of it's a USD based medications, and it's all based on importation. We would like more to be producing that, and between the second edition and the third, we opened 2 plants, medicinal plants, to manufacture biologics medications here in Egypt. So what about the collaboration between the African continent and Egypt?
Yes.
A platform was actually launched between the second and third edition for MOU signing, for Memorandum of Understanding, for collaboration and technology transfer. And the African CDC this year announced that they already started the technology transfer for all the projects I was mentioning. And they mentioned that in the fourth edition, CDC will be a partner with the Egyptian Authority, Unified Purchase Authority, and the Ministry of Health to be in the conference as the main sponsor, and they are actually asking all of health all over the African continent to join the fourth edition. So we do have a nice platform for all Africa, so we can easily trade medications all between us with a nice.
To further diversify.
Yes.
Really. So, Dr. Islam, African countries, tell me a bit about the African countries that are taking part in this year round. You mentioned earlier, before we went on air, there's 5 main ministers of health that are here, and lots of countries have come from all around the continent to attend. Could you tell me a bit more about the main partners from Africa?
Sure. So, it's all the African countries got representatives. However, I can today in the first day of the lectures from the sub-Saharan countries, from for example, we've witnessed a lot of officials from there. Today we had a lot of authority officials from Nigeria as well. They've actually attended the presidential initiative for Women Health updates. Today was the update of the presidential initiative for Women Health, which was actually launched in 2018. The launch of the cancer initiative as well. And we can all the time see, while discussing with our African partners in the conference, that they are asking how can we actually transfer these screenings and all these programs to our countries. A very nice case study, for example, today from Nigeria, on how the Nigerian Minister of Health, the Egyptian Minister of Health collaborated in terms of cancer management and in terms of protocol of treatments between the both countries.
Excellent. That is a true example of really how also expertise can be transferred from one country to the other. The presidential initiatives with regards to health, we have the 100 million healthy lives, we have early detection, we also have screening in school. And I am aware that African countries are very keen with school programs, whether it's nutrition or screening for childhood diseases, etc. Are there collaborations in this regard?
Yes. So we do have 14 presidential initiatives.
Right.
And the one you are mentioning is one of the top priorities, which is the screening for anemia, stunting, which is short stature, and obesity. Three risk factors. They are actually one of prevalent, especially for this generation at school age. And the Egyptian government managed in 4 years to have a program that every year they are screening 10 million school children for the three precursors of significantly. It was decremental from 4 years till now, almost 50%. We decreased the percentages with 50% or more, and actually with the junk and fast food trends around.
Relatively the poor nutrition as well.
The malnutrition, yes, and for malnutrition there's another strategy. For example, we do have the Egyptian national strategy for nutrition, malnutrition and diseases related to malnutrition. Another aspect, for example, you mentioned in presidential initiative is 100 million healthy lives, and from that we had the HCV, the hepatitis C virus, which is one of the biggest achievements for Egypt. And we transferred the presidential initiative as is to the African countries. So we currently have 3 countries running the same presidential initiative for hepatitis C, the chronic hepatitis campaign. And of course, needless to say that in Egypt we managed to screen 60 million Egyptian citizens for hepatitis C. That's again
and not just screen, but provide medicine and treatment.
And provided treatment for 4 million.
Which was previously very, very expensive and very difficult to get, and people used to try and get it overseas.
It's a very good example for localization. For example, one case it was costing 150k Egyptian pounds, 150,000. Currently we are treating the case from A to Z with around 3,000 or 4,000 Egyptian pounds. So we're talking like 1% of the cost. That's because of localization, for example.
Absolutely. Right. So Dr. Islam, over the last 3-4 years, more than 300%, which was a demand really of all Egyptians over the years. What sectors received most of this? How does this 300% increase in the budget translate on the ground when it comes to patients? At the end of the day, what is your concern as a health professional or a health practitioner? Is the patient at the end of the day science to get
2 billion Egyptian pounds of a budget, and if you add as well all the health authorities, we are talking about 350 billion pounds. So it's tremendous increase.
Absolutely.
And the main focus and the main budget allocation currently is like 50 billion out of this budget is going towards health service providing for the new health insurance authority. You know, the health insurance, the new one, the new law is covering currently 6 governed rates, and the plan is to add another 6 in phase 2, and by 2032 all the Egyptian governed rates should be actually covered by the universal health insurance. It's a huge project, and every year there's huge budget towards it. Another allocation, very important one, is for preventive measures. As you know, if we are spending in prevention, we are saving a lot of money. $1 in studies in preventive medicine will save $14 in curative medicine. So we need to focus more on that, and that was obvious in presidential initiative. Today we presented the result of the return on investment of the presidential initiative, and actually 1 Egyptian pound spent, for example, for breast cancer early detection was saving 1.31 Egyptian pounds. So we're talking about 31% on investment, and it continues. Every to be launched, we do a policy framework to ensure that we are gaining lives, we are gaining better quality of life for Egyptian citizens, and we are gaining for the economy. And both are actually together moving along, because when you are treating people, you're having an individual, more productive individual with more return on investment. It's all returning back to the economy.
Absolutely.
Yeah.
Right. On the point of healthcare funding and budget increase, we actually have a report on this. So let's take a look at the report and we'll be back for more. Do stay tuned.
Is making significant strides in healthcare following the 2023 rollout of the second phase of its national health insurance program. The country aims to achieve full nationwide coverage by 2027, 5 years ahead of the initial schedule. Substantial investments in healthcare infrastructure bolster this ambitious goal. Upgrades and new facilities are being built nationwide alongside crucial training initiatives. Over 21,000 training programs have been provided for medical teams, and 157 health facilities have achieved international accreditation standards. Egypt's government is set to increase its support for the healthcare sector further as it announces a significant boost in funding for healthcare, education and scientific research in the upcoming fiscal year beginning in July, according to Finance Minister Mohammed Maid. Maid announced that health sector allocations will jump by 24.9%, reaching $10.4 billion. This aligns with the nation's Vision 2030 goals of improving medical services for citizens. Additionally, the education sector funding will see a hefty 45% increase, reaching $18 billion. Scientific research allocations are also slated to rise by 40.1%, reaching over $2.9 billion. The minister emphasized the government's commitment to expanding healthcare initiatives, ensuring a steady supply of medicine and equipment to hospitals, and strengthening health insurance programs. He also highlighted efforts to accelerate expansion of comprehensive health insurance coverage. The budget announcement follows a social package implemented in March, allocating $350 million for salary increases for doctors, nurses, teachers, and university faculty. The breakdown includes $170 million for university teachers, $33 million for university faculty and staff, and $24 million for medical professionals and nurses. It follows President's efforts in 2022 to strengthen cooperation with the World Health Organization to bolster the country's healthcare system.
Welcome back, ladies and gentlemen. Still with you, and tonight delighted to be joined in the studio by our guest for this evening, Dr. Islam Anan, Lecturer of Health Policy and Health Economics. Once again, Dr. Islam, it's a pleasure to have you with us.
My pleasure.
So, Dr. Islam, you attended, of course, today the inaugural session. Could you tell us a bit about some of the main topics that were raised, the main things on the agenda?
So one of the main topics, a new one, is how to apply health data governance. And this new project led by the Unified Purchase Authority. It's very important that we do have data governance. Just to make it easier, data governance or health data governance is to make sure that we do have a correct, valid, complete data input where we can actually process, and then we do have a good, usable data, and finally data integrity and data security. So all of these aspects, it's under the umbrella of having good procedures, good policies to ensure that all the data input inside our healthcare system is correct, is valid, and all the data output in terms of validity is actually correct. Finally, this will help in what we call an informed decision making. So the decision making is not based on assumptions, it's based on information coming from valid data. This is not an easy project because it involves a lot of stakeholders. We do have a lot of authorities in healthcare and a lot of ministries as well involved. So we need to make sure that all of them are actually integrated in the same governance cycle to make sure that all of them are correcting and putting training and capacity building for data governance. Data governance, of course, is not about data analysis, because that's another issue, but having policies and procedures to making sure that the system is actually sustainable and the data science is actually sustainable. The other side of the mirror is actually having good data, doing electronic medical records.
Accurate, yes.
Yes, and to have the mindset and culture of this is the hardest milestone and the roadblock that was discussed heavily today. How the mindset of healthcare professionals and administrators that data is valuable, that data is more expensive than oil, and we need to treat it as if we do have a mine, a good mine that we can actually produce, we can process, and even we can sell. Countries currently are selling their data with billions and billions of dollars. And so this is source of resource, a good resource to any country, and a good income, of course, and a good revenue to the GDP. It was one of the main highlights to be actually starting or kicked off tomorrow in Egypt. And a lot of African countries were actually concerned and saying how this is going through, because a lot of countries, they lack the health system. Do have it, but product between and we can actually as well benefit from other countries that they do have patient act, for example, confidentiality. How can we transfer something like that to Egypt as well? So it will be a transferability between the countries in terms of that. That's for health data governance. Another highlight of the day is the launch of the second phase of the cancer initiative that was launched by President Abdel Fattah al-Sisi to treat 4 cancers, including prostate cancer, including bladder cancer, cervical cancer, and lung cancer. These are actually 4 main cancers and leading deaths for Egyptians, unfortunately. The most prevalent and the most actually with high incidence in case fatalities. So the second phase is usually the treatment. So we are talking about a presidential initiative giving the treatment for all the screen patients for free. We're talking about millions as well. Around a budget of 20 billion Egyptian pounds were actually allocated for all the presidential initiative, and the top priority is the cancer one and mental health as well. So for these both initiatives, it's very important to ensure that we do have a healthy citizen. A nice comment His Excellency Professor Dr. Khadwa Afar is we are focusing currently well, the chronic hepatitis cases that we cured in the HCV campaign. Some of them unfortunately developed hepatic cancer. So how can we treat and prevent in the future having more cases of hepatitis and for hepatocellular carcinoma? If we move to another aspect of the story, the insurance aspect, the launch of important and very good to wrap up because we are running out of time. Insurance, a very new program. It's new for Egypt, but it's not new for some African countries. It's been there for years. Could you tell us in a nutshell the initiative, it's already started in 6 governorates, as you said, and you know, futuristically, what is this initiative aiming to do? Okay, the aim is to replace all the health authorities in any governorate they are launching the new health insurance in, and then having all the family as a household to be enrolled under the reimbursement system, under the insurance system, to receive all the treatment for free. Will be actually paying premium if they can, and the country will subsidizing and paying on behalf of underprivileged families who cannot actually pay the premiums. So in 2030, as I was just mentioning, we will be covering all Egypt. We launched 2 currently. Another 6 governorates by end of this year will be as well enrolled in the program. And the main thing is we would like to flip the image, because currently we do have 80% out of pocket in terms of medications and 20% from governmental sector as a whole. In 2032 we would like to make it a 20% only out of pocket, so we are decreasing the burden on the citizen, and 80% will be on the behalf of the government expense, which is the new insurance system, inshallah.
Wow, that's very interesting indeed, and very, very optimistic. On this very, very positive note, I am afraid we have run out of time. I'd like to thank you very, very much, Dr. Islam Anan, Lecturer of Health Policy and Health Economics. Dr. Islam, it's been an absolute pleasure. Thank you so much for your time, for coming in. I know it's been a long day, so I really appreciate you coming in this evening, and wishing you, of course, the best of luck.
Thank you. Always a pleasure to be in Daily Debate.
Thank you so much. Thank you so much, Doctor. Ladies and gentlemen, that's all the time we have for tonight's edition of the show. We do hope you have enjoyed it. You're in the company of myself, Angie Meher. Many thanks for joining us.